Hello.
Hi, Dr. Paraliciti, how are you?
I'm
Yes, I can hear
good.
you. Can you
Do
hear
you
me?
hear me well? I'm trying to see if my microphone is really working, but I don't think so because otherwise we would be
Oh yeah,
hearing
I can hear
something
you. Can you hear me
weird.
okay? Okay,
It's
okay, good.
I can hear you
Okay,
okay. Perfect.
perfect.
Thank you.
Thanks for joining me. We have a couple of minutes before we start, but I just wanted to thank you for joining me today. This is such an important topic that we're going to be talking about. And I think a lot of our listeners are very interested in hearing from you because this is such a huge need in our community as well. So I really appreciate you taking the time.
Thank you. Thank you for having
Um,
me. Very excited.
so,
Thank you.
Dr. Paraliciti is from San Juan, Puerto Rico, and she's currently in Florida. Is that right? You're in Florida? Where in Florida are you?
Correct. Yes. I live
Okay.
in Palm Beach County,
Okay. Okay.
West Palm
Nice.
Beach
And your
area.
practice is
Yes.
there. Is that right? Okay. Um,
Correct.
so Dr. Paraliciti is a trained psychiatrist. She was trained in New York and has been exposed to a wide variety of patients. She specializes in the treatment of depression and anxiety, and she has done both adult and child and adolescent psychiatry training programs. So I'm so super excited to have her as she's so skilled in the conversations that we're going to have. She also specializes in the treatment of depression, anxiety, mood disorders, ADHD, and PTSD in children and adults. And I want her to specifically talk to us because we're focusing today on recognizing signs and symptoms of depression and anxiety. And we also want to focus on decreasing the stigma behind these diagnoses, especially in my patients with PCOS and diabetes. And as you know, my focus has been always on recognizing diabetes, treating diabetes, and also doing the same for PCOS. So recognizing signs and symptoms of PCOS in children and adolescents and giving them the treatment that they need. So I think this is a very important topic, and I'm so excited to have Dr. Paraliciti here today. Sure.
Thank you. Thank
So I think we
you.
can go ahead and get started. And I just want to talk to you a little bit about how
Mhm.
common is depression and anxiety in youth overall, and then we'll focus on, how common it is in PCOS and in diabetes.
Anxiety and depression are actually the most common conditions that we can see in teens, adolescents, and children
Uh-huh.
nowadays. And of course, it has increased significantly after the pandemic, particularly in kids with, in children, in girls or adolescent teens, girls with PCOS, obesity, or diabetes. We have an increased incidence of
Mm-hmm.
depression and anxiety in this population. Not only because they are, in the stats of the ages, but they also manifest other signs, symptoms, and lifestyle
Mm-hmm.
things that makes them more maybe self-aware of their own self-image or the way they feel different. So they are added factors to these teens that go that have this type of metabolic conditions,
Mm-hmm.
because it's not only metabolic silent processes happening in their inside their bodies. There's a lot of external signs and symptoms, particularly skin and other areas, that in girls make them more aware and more anxious and more, their
Right,
self-image and embarrassed, shame, all
right,
those emotions.
right.
So that adds more into their plate. So yes, it's very common, and it's very important, the screening of all these patients when they are with their pediatrician or their endocrinologist,
Right,
due to the high incidence of
right,
mental health issues in
right.
them.
Yeah, so I think, for our listeners, I think we want to first focus on, PCOS and the diagnosis. And usually they see me first, before I send them to someone like you. But I do see, a high incidence of depression and anxiety in young adolescents with PCOS and in diabetes also. And PCOS really, diagnosis is given in teens when they have irregular cycles, or they have signs and symptoms of increased acne or hair growth on their face, or places that, we as, young women don't want to have hair. And, the true sign is menstrual irregularity. And then, a large proportion of girls with PCOS have a higher risk of developing diabetes. And so, I think when they come to me, they already have some of those questions about, do they have PCOS and is this a diagnosis? But oftentimes they come to me already with a lot of anxiety about the diagnosis.
Correct.
And then once they're given the diagnosis, they really have even more of concerns, and then they have body image issues too. Not all girls with PCOS have issues with weight. Some of them do, and that's a big concern for them. So tell me, when they come to see you, or when I refer them to see you, what types of signs or symptoms are you seeing, or what should parents look out for? What are some of the signs that they should say, okay, this is a time that maybe they should talk to somebody, rather than trying to manage some of the symptoms on their own at home?
So it could be both ways. Usually, most commonly, they already come to me with the diagnosis, and usually we already have like a pretty long period of not adjusting to the new changes and just all the new things that they have to learn. So they have issues processing the diagnosis and all the things that intakes or takes this process. So there's a lot of uncertain, there's a lot of fear, there's a lot of worries. Remember that every time we get a diagnosis as a parent or possibly an older teen, we immediately will go to Google or to all our immediate resources and start reading all the tons of information that it's out there, that it could be reliable, good information, or not real information. So we can get even more confused.
Right.
So basically, during this period of, I don't know what's going on, I got the diagnosis, most of them don't have the time with their doctor, pediatrician, or endocrinologist to go over the whole thing so they can know what to expect, prognosis, treatments, evidence-based, now scientific, like we can treat this condition so they can feel better. So not having all this info immediately when they get diagnosed, the whole family is going through a stressor, and the kid and the family trying to figure it out what to do. In this process, we start learning new information that it is not positive knowing everything, because we now know a new piece of information, but we don't know the rest that comes with that information. We will get even more fearful and more confused. At the same time, we're manifesting this girl's all these external symptoms of self, so body, but the acne, the hair growth, all the things that you mentioned. So at the same time, we're having a decline in self-esteem. So there's so many processes going on that by the time they get to me, there are probable more signs of maybe self-isolation, be more in the room. That's more depression. They tend not to be as talkative or social as before. They are not as communicative with their parents. They are more into themselves, period. And at the same time, that's more depression, that decline where they internalize a lot of things. Anger can go up also because teens tend to externalize a lot of their emotions, and even more when fear of the unknown it's there. It's like a frustration of and just take it out. It's very externalizing. But at the same time, going through this depressive mood decline, the brain, the worries, their thoughts, maybe they're read around there, infertility, it's a number one thing in PCOS. Now at the age of 16, 17, 15, I'm thinking I probably won't be able to be a mom. I probably won't be able to be a fulfilled, I don't know, woman, mom, whatever plans, dreams we have, because at that age, we all have plans and we see our futures. So it brings them down to a point of not having purpose, of being so fearful, of And then if we leave these issues to keep going and developing into more complex processes, then it's when comorbidity starts to even increase and come in on board. So these kids that have PCOS and maybe already obese and maybe already with diabetes, at some point can develop another metabolic condition as part of a comorbidity, or an adding anxiety disorder, or an on top eating disorder, because many of these kids or girls just develop this mechanism of control of their own body, saying, I'm going to control what I'm eating, and I'm not going to eat anymore, because, or it's a matter of, it's a self mechanism for self-control, but we are really hurting ourselves.
So I guess, you know, from what you're saying is, and I took down some notes. So what you're saying is, if we see our teen girls, and sort of we're focusing on teen girls because we're talking about PCOS, but if we see our teen girls who suddenly, you know, start having, or maybe it develops over time, but suddenly have a change in their mood, or they start to internalize things and keep more to themselves, or sometimes they externalize and they're more angry, or they have changes in their eating behavior. Maybe they're not eating as much, or sometimes eating more as sort of comfort. Or, you know, their sleep. We didn't talk about that really, but, you know, sleeping too much, or having, you know, low energy or low desire to do things that they thought was important before. Those are reasons probably to you know, to be concerned or start having these types of conversations.
Correct.
Is that right? Okay. And then, you know, from a parent perspective, so I have a teen girl myself, and so yes. So, you know, what do you suggest for parents when they're trying to have some of these conversations with their children, and then when they're actually trying to make an appointment with someone like you, or they're referred? Because I do think that there is, you know, some stigma around mental health and these mental health concerns. And so how do you recommend parents actually address some of these issues themselves, and then convincing their teens to come see a specialist like you? What are your thoughts about that?
So usually for me, it's a step-by-step thing. Okay, so first of all, as a parent of a teen, we're not alone. Okay, so we are the ones that knows our teens, and we are the ones that know their regular behavior. So your doctor won't know, your people around you won't know, other than you parents being the ones that really notices these changes. Teens, as default, they are moody. They will have, you know, days of not sleeping. They will have days, you know, they are just this roller coaster. So you know your child, and you know, oh, maybe this is just another whatever. But we need to be able to identify red flags. And those red flags are maybe adding new behaviors that were not there. And I'm like, okay, wait, now I'm noticing she's not coming to eat as she used to in the family dinner, or she is staying in her room longer. So things that, new behaviors that were not there before, and you start tracking over time, maybe watching for a pattern, or maybe, I mean, you're not looking for worsening behaviors, but you're more on the loop. If there are anything that it's totally off, that you say like, this is not my daughter, this is not the way she acts, talks, anything, it's just changes, you know, the first step is definitely talking to your doctor, the one that you know, the pediatrician, the person that you trust, period. Maybe we're not connected yet to a mental health specialist, so we really don't know what to do. So we will take the first step of talking to our doctors, sharing our concerns, maybe asking questions if we're not really sure of what's going on, and they might reassure you, oh, that's just normal underage, or this is not normal, let's move further. They might be able to give you resources and send you to a therapist. And then through therapy, the therapist will go over the whole picture, the patient, the family, their lifestyles, their dynamics, everything together, and they can come up with some sort of plan, do cognitive behavioral therapy, working on teamwork, education, all those things. And if after a period of time, either symptoms doesn't get better, because we now are going through this therapy and we're learning strategies, skills, and other things, but my daughter's still not there, and my daughter's sleep not improving, and I'm noticing her sleep is not good, and I'm, either not worsening or staying the same, then we move forward. Okay. Either we can go to we can make a full testing, not covered by insurance many times, so, and it's very expensive, so people usually go directly to the psychiatrist, and then it's the specialist coming in and evaluating all the areas, all the things that we tried to approach this problem.
Yeah.
And I do have many that comes directly to me without even trying therapy, because they see so much severe symptoms that they are just afraid of waiting more. And then there's a lot of evidence on the effectiveness of both medication and therapy, making it a little bit faster to reach progress. So starting medication, usually we do it a lot, start medication in conjunction with therapy, and then we see that kind of process move on. The symptoms, as we mentioned, can be environmental, can be internal, can be genetic, and can be metabolic. Okay, so there are risk factors to have these symptoms from every single area of that patient. Just because we have the PCOS and insulin resistance, but possibly that makes our serotonin go down. When we are depressed and anxious and we're all over this negativity, our serotonin is down. When we are going through different challenges, adversities, all these things decreases our release of serotonin. So having the issue coming from so many angles make it more clinical depression more difficult, and we really need to treat it from every way. So therapy will take it for most of the psychological part of it, behavioral part of it, and then all those physiological processes, chemical imbalance and all that, we do it through the medication treatment, usually as eyes, and to try to stabilize those levels. But it's a process. Getting to medication, for me, we need to try everything else, and we really need to focus on the lifestyle changes of the family, because if there's siblings, if there's I don't know, grandparents living in that house, or so, we all need to follow a complete plan, so that teen, youth, girl doesn't feel more left out, more different, more ashamed, or more embarrassed for having this condition that makes me different. So it's a process, it's a long process, but there is good prognosis when we pick it up early and when we intervene on time. And with family support and education resources, everything is much easier.
Yeah. So I think, what we're hearing is mainly what we want to focus on is getting the diagnosis early, trying to recognize the symptoms early. And, I focus also on getting the symptoms and diagnosis of diabetes early, getting the symptoms and diagnosis of PCOS early, because many girls who have PCOS actually have gone to 3 different doctors before they even get the diagnosis. And like you said, there's a lot of anxiety about what the condition is. What does PCOS mean? And so they don't have someone to talk to about what that diagnosis is. So that causes a lot of anxiety by itself.
Of course.
And so I think, that's part of the focus that I have, is focusing on these girls who have, depression and PCOS, because it's so common. I've seen it so often in my practice. And, if we switch over, to the diabetes, I mean, if we talk about PCOS and diabetes, there's a large percentage of girls with PCOS who develop type 2 diabetes. I also see girls with type 1 diabetes, young girls, and, that's a little bit different picture, although it is, still a chronic illness. And I see a lot of teen girls with depression in type 1 diabetes. And I also see a lot of young girls with both conditions, type 1, type 2, and with PCOS who have anxiety. So I wanted to talk to you a little bit, and we have, a couple minutes left, but I wanted to talk to you a little bit about anxiety and, symptoms of anxiety. I think we talked a little bit about depression,
Yes.
for girls, but, a lot of us have anxiety, I think, and I see a lot of high functioning teens who have anxiety.
Yes.
And, I want to talk to you a little bit about when is it worrisome, and, when is that something that also needs to be referred? And I will, start off by saying that I have seen a tenfold increase in anxiety in kids after the pandemic.
Definitely.
And I don't know if you've seen the same thing. So we've seen a lot of increase in anxiety in kids who otherwise didn't exhibit any signs. And so I wanted to spend a little bit of time talking about that, because I think that's something that we need to know as parents, what's normal and what's not normal as far as anxiety. And some kids have school anxiety, they have different types of anxiety. So I want to focus a little bit of that and get your thoughts on that.
Yeah. So, I mean, as we said before, anxiety, it's really first of all of us have anxiety. It's part of our life. So basically, if anxiety becomes a problem, which becomes for many, many people, it's a full-blown physiological reaction in our body. And anxiety it's a family. So anxiety, it's just a word that means many symptoms, but in the anxiety disorder umbrella, there are many anxiety disorders. So someone can manifest general anxiety symptoms here and there, and many kids can develop more specific anxiety disorders. So what would make this anxiety from normal day-to-day anxiety to a stressful disorder? Anxiety disorder will be the decline and the distress in our body, the decline in our functioning over time as a person. So these girls, so it's just a decline, and they start to avoid. For example, if I'm already in the depressive part of my self-image and I feel uncomfortable with the excess hair growth or acne, I tend to avoid, I tend to be self-aware. My thoughts are always going over and over, oh my God, what people will be thinking about me. It's going to be a rumination of negative thoughts increasing. It's like a snowball effect on thoughts. So I explain it as a funnel. Once we have that mini thought in the base of our thoughts, and we let that thought to move on, and that thought could be the fear of the uncertain, what's going to happen, I'm not going to have kids, I'm going to be like this all my time, I'm going to be different always, all the thoughts that we come across, it just go into that funnel, and then it becomes bigger and bigger, and now our body feels heavy, and now we are breathing heavier, and now I feel my chest tight, and now I have somatic symptoms, my belly ache, I feel nauseous all the time. And all this, it's our sympathetic nervous system going off on a simple internal or external stimuli that was processed by our amygdala inside our brain and said, oh, this is a threat. And it could be a tiny little thought like, oh my God, what's going to happen tomorrow? Yeah. Only that thought could go there. There's a threat, there's danger, boom, 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 heart start racing. Everything falls apart. When that starts happening often, we start happening distress either at school or our jobs or different places. We start develop possible panic attacks. We can develop social anxiety. We can develop so many other comorbid issues. That's why we need to start early, because we don't want any of these symptoms to develop into something more complex. And more complex is the more we believe in these lies in our head, the more difficult will be for us to reverse that. But it's possible, and it's possible with very simple things, daily things that we can do that maintain our brain in a positive processing energy wise. And it helps to rewire, it helps to go into that neuroplasticity again, and to make good connections that after this stimuli come back again, now I process it and I can say, hey, this is just a lie. There's no threat here. So you start controlling better your reactions, your behaviors. But this is a process, and this is through many different modalities of therapy, cognitive behavioral therapy, even coaching, different types of skills and strategies that we can learn from different symptoms, that if we take it from the bottom of the problem and we said, no, that's a lie, I'm not going to let you go off hard, I'm going to take control, and we can do that through breathing. So it takes a lot of education and things to start getting that awareness, but we can get that control, and that will prevent us to keep making it bigger and bigger and to develop into more complex processes. So that's the beauty of taking care of yourself and self-care habits, lifestyle changes, all those activities to avoid complications.
So for anxiety, I guess if I'm, hearing you right, you're saying that a lot of times it is our thoughts that are sort of overtaking overtaking things, and then it results in our body having these signs and symptoms. So, having increased heart rate, or having, nausea, or vomiting, or belly pain, feeling dizzy. So all these signs and symptoms are coming from, those feelings of having, not of anxiety, or having those thought processes. And I guess what you're saying is that we need to control our thought processes and teach our kids how to control their thought processes so that they can recognize that feeling, anxious about this is how I'm feeling about going to school today, but I need to focus on, it's really, how I'm feeling overall. Is that what I'm hearing?
I lost you for like 2 seconds, but yes.
Okay, good. And so at what point do you think that our kids who have these signs and symptoms, say they, go to cognitive behavioral therapy, or they do some, the behavioral therapy for a period of time, and how long is that before you think, they need medication to control some of these symptoms? Because I have some patients who are not going to school, for example, because they have, some of these medical conditions, or just in general, overall, there's other, issues in the home that are going on. And so at what point do they need, medication, and how long do they need to do cognitive behavioral therapy before you consider medication? Or is that something that you do all at once?
There's no right or wrong answer. It depends on each family, it depends on each case severity. If I want to start with therapy and I refer them to a therapist, they will have a treatment plan with that therapist. However, usual, average, ideal should be weekly 2 weeks, 12 weeks of weekly therapy, 3 months basically. It could be longer, it could be shorter, depending on clinical response. But usually it's based on the impairment and decline in the functioning of that teen, either at school, at home, in their overall. So the more severe, the more medication is indicated. There are parents that sometimes are struggling with not severe concerning behaviors, but they're persistent behaviors that has led to a decline in some sort of function. So we also consider medication there. There are comorbid, so many comorbidities that we need to identify and treat. If there is a kid with, let's see, ADHD, for example, PCOS, diabetes, we have to treat that too, because that will also increase the anxiety and frustration of not controlling those symptoms. So again, it's a very complex thing, and every case is different. But when we get to the medication stage of it, and now we decide to go to medication, we go through everything: risk, benefits of treatment, and usually benefits should outweigh the risk, so we can actually go safely into that option. And treatment can be as short as 9 months, 6 to 9 months. if good, stable, great case, successful treatment, usually after 9 months, we are already discussing about discontinuation of meds.
Okay, good.
But when something more chronic, persistent, and severe, usually goes longer, and it depends on each case. There's no specific term. It could be years. Some people have real, true chemical imbalance that needs that replacement all the time, like a diabetic needs their insulin, right? So some kids, some people have chronic long-term treatment on meds. Others learn how to cope and control their issues or symptoms through strategies and skills that they learn through therapy or through life in general, through group, through support, through others. And they learn how to maintain a kind of a good, average, normal life. So there is ways to feel good, in control, and balance. I don't think perfection and happiness is 100% ever. That's a state of mind. So, you know, but we can actually see things in a different attitude and perspective. And if we really look into the positive, we will find many. So it's help. It's don't take all this to yourself and look for help and support, because there's many out there.
Okay, good. Thank you so much. I think that's a good point to say, you know, because sometimes my patients say, if I go to a psychiatrist or a psychologist, am I going to have to do this forever? And I think it sounds like, you know, maybe, but maybe not. And so I think that's important for them to know that maybe, you know, this is something that will be a short-term issue, but there may be something else that you uncover that requires lifelong therapy. And that's okay. I mean, that's okay as long as they're feeling better and their mental health is good. I think that is fine.
Yes.
So, I really appreciate your time. I think, is there anything else that you wanted us to know? Otherwise, I'll let people know where to find you.
No, I mean, the only tip to anyone who is watching is, like, you're not alone, and please just ask if you have a question, if you're on, if you have any doubt about your teen, or your teens has any concern or question and they don't understand something, call your doctor. Talk to someone that can give you the right information so we can feel better about what is there. But if we look into just us and looking into the internet like that, we're gonna get it's gonna be not a happy camper there. So it's gonna be, oh my God, a lot of worries. So do it right. Call your doctor. You're not alone, and always, ask for help.
Right. Okay. Thank you so much. Thank you. Dr. Paraliciti, like I said, is the owner and CEO of Psychiatry Boutique, PLLC.
Yes.
She is located in Florida. And how can people find you if they need to talk a little bit more?
So I have my website. It's www.psychiatryboutique.com. My email is dr.p, Dr. P, at psychiatryboutique.com. And I have a Facebook and Instagram page, which is Dr. P _ at Psychiatry Boutique.
Okay.
And what else? I have LinkedIn too, Mariel Paraliciti Morales, MD. And I think that's it.
Okay, great. So we'll post some of these links for our listeners after the Instagram Live. But I really appreciate you taking the time to talk to us today. This is a very important topic, and I think our goal is just to have increased awareness. Definitely. And decrease stigma regarding mental health. I think it needs to be addressed, and it needs to be addressed early is the message that we're getting.
Definitely.
And the other message that you gave our listeners was, if there's anything that is not just how your teen is or how they act, how they normally act, that's a time to just start thinking about it and talking to your doctor about that. So I think those are all very important points. So thank you.
Thank you for inviting me.
Okay.
Have a great day.
Take care.
Happy Friday.
Happy Friday. Okay, take care.
Bye-bye.
Bye.